So I'll be guiding today's meeting. And before we delve in, just please allow me to share a few thoughts about Jet. So, as many of you have followed along on social media the past few months, Jet and I became fast friends and forged a strong bond during her long hospitalization. And thankfully, as I'm sitting here in my Duke office today, I can look over and see the building where Jet was receiving care for those many weeks. And throughout that period, we had some pretty candid and heartfelt conversations about our seemingly parallel lives and found that we had so much in common in our shared journeys with cancer, our personal interests, and the broader challenges life throws our way. So these exchanges continue to be incredibly validating, and I feel like I found a friend that truly gets me in terms of our shared experiences. At this point, I'd like to recognize two important people to both of us, Paul and Gail, who were also a huge part of Jet's dream team. Without them, I'm pretty confident in saying that we were just worked wonderfully together to support each other and Jet through this really challenging time. So thank you guys. Lastly, witnessing Jet's remarkable courage, unwavering determination during these weeks was really inspiring. And it's no wonder that Jet shares the same birthday as Michael Jordan, the greatest basketball player of all time. And oh, yeah, me too. And Jet, I remain in awe of your strength and resilience. And I'm pretty confident that our tribe will feel the same way about you after they hear your story. So I'm going to stop now and say I'm delighted and honored to pass the spotlight to you, Jet.
Thanks, Sophia. And thank you for everything that you've done for me this last couple of months that I've been out of the hospital and in the hospital and not knowing where I was actually for 2 of those weeks. So thank you for everything. My name's Jessica. My nickname is Jet. It's also the name of my fitness training business. So if you hear people refer to me as Jet, that would be me. My last name is Bolz. I was diagnosed initially with Hodgkin's lymphoma while I was still an adolescent. I was 11 years old. I was treated, I'm going to quickly go over this so that we can jump right into the big part about the transplant. I was treated initially with radiation, 3,900 cobalt rays to the chest and abdomen. Like so many other people, I was over treated with radiation, and it caused a host of problems. I relapsed with my Hodgkin's not long after finishing radiation. 3 months later, they found a tumor growing again in my chest. This time I was treated with ABVD protocol, the Red Devil, adriamycin, which did some other great work to my heart and damaging it. 15 years later, actually 12, it was 1998, I was 25, I was diagnosed with my first breast cancer, had a mastectomy and more chemo. 2006, after I was married and had 2 children, I was diagnosed yet again with my fourth cancer, which was another breast cancer in my left breast. All of these were managed with drugs like chemotherapies and monoclonal saving therapies, which are protein, which was the Herceptin. I was kept on the Herceptin for way longer than the protocol asked for, considering I had Hodgkin's disease. After 5 years on Herceptin, my cardiologist at the time noticed how much my ejection fraction had gone down, and he said it was time to stop that drug. So let's fast forward a little bit. So years are going by. My husband passed away. suddenly in a car accident, and I found myself in a weird situation in New York where I could no longer take care of the kids and myself. So we moved out to North Carolina, where I started working for Duke, which would serve purposes for me right now in the latest part of my journey. So I became a fitness trainer and I started working for Duke Diet and Fitness. I was a water fitness trainer and lands. And I think I inspired many people who felt like they couldn't do much with their life to start over again when I told them my story. Um, the last couple of years, I had been told by my cardiologist my aortic valve had gotten to the point where it was severe as far as the stenosis. My mitral valve also was severe, but I was living with that and not having much problems as far as symptoms. That all changed last August. I started to develop symptoms, and it wasn't this August, like I'm losing in the COVID span of time. So I think it was the August before. So I started to develop shortness of breath, and it escalated quickly. It got to the point where I was trying to climb steps, and as a fitness trainer, not being able to ascend, I was like, what's happening to me? Uh, then I was walking my dog, and I noticed I couldn't go up a hill without stopping, grabbing my chest or my knees. I went for what's called a BNP test. My PCP ordered it. Your numbers are supposed to be in the hundreds. Mine were in the thousands. She told me I was in cardiac heart failure. And I realized something was very, very wrong with me because I couldn't take a breath anymore. I met with the doctors over at Duke. At that point, they wanted to open me up and give me artificial replacements for my valves. I said no. In normal Jessica fashion of being an Italian New Yorker, I'm a little bit stubborn and oppositional, and I pushed to have the TAVR done. They did not want it for me. They felt like everything was too severe, and they wanted me to go on with my life without much of a hassle. Ha ha ha. As a survivor, we know that we're constantly in and out of some specialist office with having to go for some other yet treatment or test or blood test or CAT scan. So I was used to that, and I pushed for them to do the TAVR, which they did. After it was done, everything was good. And I had read that my mitral valve even might pop back on its own, which it did. It went into moderate instead of severe. My cardiologist was optimistic and hopeful, as was I. In the interim, I had a fibroid. This is important to my story, which I had had a sonata done, which is an ablation of the fibroid. Shortly after that procedure, I started bleeding and hemorrhaging. I went back to her and she said, this doesn't happen, as well as my fibroid specialist. And they brought up the C word, which I can't even bring myself to say most days. I refuse to listen to that because I think the fear monger is always thrown at survival. Patient, I don't like to refer to myself that way, but we can't leave an office most times without them throwing that C word out there. So I left that office, but before I did that, I asked them to put me on the drug or Lisa, which I was taking. This is an anticoagulant drug. I'm sorry, it's a coagulant. So what it does is it makes the bleeding stop. And while I was on that drug, I felt like I was having some chest pains, some pains in my carotid. And so I stopped. Bleeding had stopped, and I felt the drug did what it needed to do. I was in the pool. I'm going to fast forward to present time. It was November 6th. The day before, I had some lightheadedness, but I was at the nail salon. Sometimes the smells in the nail salon could do that. It wasn't the first time that I had felt lightheaded, so I wasn't that concerned about it. I went home. Next day, I went to work over at Duke as a physical therapy aide. And right after that, I went to personal train in the water. I was in the water for about 15 minutes with my clients, and I went to go on my sides, do some side kicks, and noticed I was getting that feeling again that I was going to pass out. So I told my client that was behind me, I'm going to faint. I need you to push me into the side. That feeling escalated, and she told the other client, And I fell right on him and I said, "Help me, please." He pushed me over to the side. And basically, I don't remember them bringing me out of the pool. What I do remember is telling them, "Whatever you do, don't call 911." Ridiculous, I know, but at this point, I don't want to be an alarmist when, in fact, I was going into cardiac arrest.
Oh, Jesus.
I woke up and I was in the hospital, so I had lost 2 weeks of time. What had happened is I flatlined and they brought me back with the paddles, which I felt before passing out again. I would soon meet all these people weeks later, and their first words out of the doctor's mouths would always be, "I know you, but you don't know me," because they had been there when I flatlined. So I had had a massive heart attack. When I woke up, my parents, and just give me a minute because this part's a little hard, and my sister and my son, who's my health proxy, would tell me that they had gotten a priest in and given me last rites. But as everything, I usually try to defy the doctors, which I did again. And I came back from that and they told me they thought they could get my heart back. In the interim, I got pneumonia and I couldn't be placed on any kind of a wait list. You can't do that when you have something like pneumonia or the flu. And I told them that absolutely I was not getting a heart transplant. I thought that getting a transplant meant death. And I also, at that point, wasn't sure I was afraid of death anymore because of what I saw when I passed. And I'd been in a position so many times that I didn't fear death as much as fearing quality of life a lot of times. And so when I came to, another stern doctor came in. This is after weeks of therapy and trying to get well from the pneumonia, and told me that I had died actually 3 times. My son had fought really hard for my survival, and she knew about my past and how many people I tried to help. She thought that it would kind of be in congruence with me helping other people, that I want to help myself so that I could continue helping people. She also told me that it wasn't a question of when I would die or if, but it was how long if I didn't get the transplant. That kind of woke me up. So I said, yes, I'll get it. I'm an AB positive blood type, which meant for me, luckily, that I was a universal recipient. When I was able to get on the list the same day that they put me on the list, the Duke surgeon came in and told me they found a donor. That was pretty much unheard of. So I felt like the universe was working with me, although I have to tell you, the shock of going through everything I went through kind of quelled most of my fears that I had. So 2 days later, it was December 9th, a month and 2 days after my initial massive heart attack, that I got a new heart. I woke up after the surgery, which was supposed to be a 15-hour surgery. It was 6. So I know that a lot of people that are Hodgkin survivors are told that not only that they can't get a heart transplant, but everything is really much more difficult. And that wasn't the case. In my case, they said everything ran really smoothly. They closed me up, and even my scar right now is barely visible. I will tell you that a lot of what I'm feeling right now is tightness and pulling, which is part of the healing process. And I had a tracheotomy too, because when this all happened, I had a lot of trouble breathing. So that was also hard to recover from. But it was hard in the hospital because I had no voice. I also lost the use of my legs. I was in a hospital bed and not able to move around for so long that when I tried to get up, I collapsed to the floor. Luckily, there were people there knowing that was going to happen, and they caught me. So I did some heavy PT to get back to where I am now, which comes and goes, and I still have problems here and there, and I'm only at the 3-month mark. So I just want to remind you that because I had the TAVR, that was supposed to help me, but because of the drug I was taking, which is called Orlisa, I think that it could have added to what I was told what really happened to me. So when I came into the ER, Dr. Looney, who I love, immediately saw me and said, where's the person who had the massive heart attack? Because I didn't fit the description. I didn't fit the description of somebody who had had a massive heart attack. I was a young woman and I was in really fit condition. So to say look out for the signs is also kind of strange because I really didn't have that many until the day of the heart attack. And what I had was not the classic signs. All I did was feel faint and then I fainted. So although this happened to me prior to it, the day before, still wouldn't warn me that something really bad was going to happen. But when he did a catheterization, which he said he did into my wrist, he found that there was a huge blood clot that had created thrombosis in the right valve of my heart. It was so bad that the heart almost burst. So they cleared that and they had to keep me alive by putting me on an ECMO machine, which is a huge pump. So it saved me, but was killing me at the same time. They knew that they had to get me off this ECMO pump because what it was doing was helping to pump the blood through, but it was too big for my valves. So each time that it pushed, there was a possibility that it could crack or break, which would cause a huge break in my valve. So they took it out and they put in something called a balloon. Now, the balloon was able to keep the blood pumping. However, it stopped working for a time and they had to remove it. But at the time, my heart looked pretty good. And they were going to see if my heart could work on its own. That was the second time I coded. At that time was when I got told, well, my parents got told, and my brother, not brother, my son, that I was dying because everything was starting to shut down, my liver. So just a reminder, this wasn't at my initial heart attack. This was about a week after. So they pulled the balloon to see how my heart could do on its own. And that's when everything started shutting down. They didn't think that they could get it back on. And they had told my parents, they don't want me to suffer anymore. And my son, thankfully, was the health proxy. And he told them to do whatever they could because he couldn't lose me. So they put on an external pacemaker and suddenly all my vitals started to come back. So in a way, it was another miracle. But I've had so many in my life, I've kind of stopped calling them miracles and start calling them part of who I am. When I came in to get my heart, now this is me moving from the ICU into another part of the ICU to get ready. Everything happened so fast. I wouldn't imagine that I would be able to bounce back, but when I woke up, I had a new heart and it was basically the next day. So although with the heart attack, I woke up thinking it was the next day, it was really a week or two afterwards. And with my new heart, it really was the day afterwards. And they wanted to get me up right away. And within that first week, I was able to get the tracheotomy removed and I could talk. And then it was just waiting that next week to get everything back and being able to eat and drink again because it was 7 weeks and I wasn't able to have anything to eat or drink. So by the time that I could, I was ready to climb out of my bed and drink out of the toilet, which actually happens with some patients. They go that crazy that they get delusional, which I was a lot before I had the transplant done. They gave me so many drugs. So I imagined people sleeping in my bed, a gnome talking to me, and many other things that scared the hell out of me. After I got the transplant, they had to give me a lot of anti-rejection drugs. And this is really the only part that I didn't understand how much the drugs were going to have side effects. I think because I was just amazed I had somebody else's body part in me, helping me to be alive. It was paramount in my mind at the time, as well as shock. I wasn't really so much worried about what these drugs were going to do in the long term for me and my quality of life. And I want to share with you this because I'm always transparent and I think it's really important. I also think that survivors have a fortitude like no other. And I don't think that we don't want the truth. I want the truth always. And I want to be able to know what's ahead of me I research, and I also take care of myself because I know that nobody has my interests as well as much as I do. So I want to be the coach on the team. I don't want to be just a player. So the anti-rejection drugs are the worst. They're like with medication right now, although I was able to avoid them, steroids. So steroids give you the moon face. They cause a lot of weight gain. They cause either tiredness or for you to be wired. For me, it was wired. So sleep was a thing of the past. It went bye-bye pretty fast. Um, then you're extremely overtired, but you can't sleep. They put you on a drug called tacrolimus. This is also for anti-rejection. You'll be on that drug for the rest of your life. What it does is cause shakiness. It doesn't sound so bad until you're going through it. A lot of these side effects are escalated if you have a cold, which I have right now. And you'll have to continue to be on the tacrolimus for the rest of your life. They will lower the medications and the prednisone you'll be off of. It will take biopsies to see how you're doing. You'll start off with one a week. You're able to get these done over the course of a day with sedatives, or you could get it done really fast in the office and with no drugs. And I've been through enough that I want drugs. So I'm up to the point now where I get them once a month. Still a big, long process. So you need to get an echocardiogram. Then you get the biopsy where they take little minuscule pieces of your heart. They stick them under a microscope and look at to see that the heart is not being rejected by your body. And you will get a lot of blood taken, which we're all champs at that now. That's the least of my problems, except I have rolling veins. So I have to get the Doppler team every time I get it done, which is okay with me because that is one of the worst pains for me, is getting my IV put in or any blood taken at this point. So it's gotten worse as I've gotten older. I also know what's coming. So they think that because I'm a survivor, this is old hat to me. And it's quite the contrary for me. I know what's coming and it scares the crap out of me. So I'm the one screaming in the room before they even touch me. So I have a great team at Duke. They are amazing. They really do care, and that's why they're rated very highly. I found that the team for the cardiothoracic unit is upscale. It's very VIP compared to the TAVR unit. I know a lot of people that have had TAVRs in the survivor program. Supposedly, I was the first one to get the heart transplant that anybody knew of. It turns out I'm not. Some people came out of the woodwork when I became vocal. And well, I mean, I'm a very vocal person and I'm a big ham. So I always want to speak to other people and I like to help others. And I know that I'm an empath, but I also know that by helping others, you help yourself. So what I do comes back to me threefold. And that sounds kind of selfish, but you do need to put on your oxygen mask first, and then you can help number ones. I'm number two, y'all are number one. So I like to make sure that I can be there to help number one. The after effects and going through everything was super tough, especially the first week that I got home. First week, I thought was going to be like in the hospital. But in the hospital, I pressed the button and I could get pain meds whenever I wanted. At home, I was being told, no more pain meds for you. You can get through this. Do meditation, breathing. And I was like, F that shit. I was like, this is really hard. And I'm a survivor. I should be able to get whatever I want. But they were afraid of mixing anything for me, especially. But for most people. So if you're getting anti-rejection pills and you have something new in your system, they don't want to introduce other drugs if they don't have to. I was already on a bevy of drugs for the transplant, so they didn't want to add to any of that, but I was getting like major headaches. A lot of that stuff was side effects from the drug, but I didn't know, the drugs I should say. But the biggest ones that you'd have to deal with are the anti-rejection drugs, which there are 3, and you take them throughout the day. And again, they will be lessened as time goes by. And I'm sure you're all there scribbling questions you want to ask about that, because that's the biggest questions I've been asked since my transplant. I also felt so weak. I didn't want to do anything. I felt really nauseous. This is the first week after I'm home. I never want to be in the hospital. And I was like, I didn't want to be in the hospital, or I felt like I didn't want to be here anymore. That's how crappy I felt. Um, it was causing a lot of stress in my household. There's a lot of screaming, more screaming than an Italian household usually has. So I did start feeling better. My PT and OT, which were paramount also in my healing process, were in the house constantly and pushing me to do my walks, even though I felt like I couldn't get up. And as I would start to walk, start to feel better. So I found that most of the times it was the morning and getting out of bed that was hardest. But like one of my cardio doctors said, you're going to start one day just feeling better. It's going to come out of the blue, which I thought was crazy talk. But it's not. Like one day you wake up and you're like, I don't feel that feeling I felt yesterday and the day before. And they can't explain actually how it happens, but it does. So I started feeling better, and the type of person I am, I just kind of go full out alpha. So I wanted to drive again, I wanted to walk again, I wanted to climb stairs again. And I felt like I went back to it too fast, because here I am at month 3 and I developed a cold. So it kind of affected everything. I was tired, but I couldn't sleep because of the prednisone. I was having a hard time getting up and sitting down. I felt like really foggy in the brain. My cognitive skills were like out the window. But I've started to get better as far as my cold. And now everything is coming back again as far as, what I can do. So I have gone back to teaching my chair fit classes, and a lot of stuff that they would say you wouldn't be able to do at this point, I found that I was able to do, because it really just depends on the person. And it doesn't depend on, she had Hodgkin's disease twice and breast cancer, and she's been cut open, and, she's not going to be able to do this because of those reasons. And it's really didn't have an effect. I had the same effect that other people didn't go through all those cancers had with my heart transplant. So nothing crazier than what they went through. As far as other things, no, at this point, I think my cognitive skills are definitely off still. I think the prednisone would affect anybody the same way. And some of you have gone through it with the prednisone, but you get that aggressive behavior because it has a tendency to do that to you. That's gotten much better for me, and I think it's helped my family to help themselves to get mental help, and that's been a win for all of us. I think that it's solidified and improved my relationship with many people, and some people it's made it worse. And I realized that maybe those people can't be in my life anymore, and to wish them well and to move on. Sure, I have days where I'm really down and I feel like, why has everything affected me? Why do I have to be the poster child for heroics? I don't want to be, and I don't want to do this. And people have said it's happening for a reason, and I want to clog my ears with tissue paper. But I do know that if you put your mind to believing and thinking about the good things, that it does change your outlook. So every time I get mad, I allow myself that grace, because this is the hardest thing I've ever done. But I like the feeling that people come to me that feel like there's nothing else for them. And I'm standing here to say, there is. If you want to live, there is. I don't know, Sophia, if I should open it up now, or do I have more time to talk? Or do you want me to talk more?
You've got you're doing great. Jet. You've got about 15 more minutes if you want, if you
Okay.
feel there's more you want to say, or we can transition. It's really up to you what you're comfortable doing.
All right, I'll speak about five or six more minutes, just
Okay.
just to talk a little bit about um, some of the things that I've gotten from the patients, other survivors, and that kind of stuff in general. I think the survivors that I speak to want to know what they should ask for when they go to the doctor and the cardiologist. And there are several, if, I would say there are hundreds of people, like I know going forward when you're going through treatment, that you fear in the future mostly about your heart, because it is the number one killer in general. But I think most people have heart issues, and I know that they have secondary cancers, but it's the heart that usually trumps all. So I always say to get your echocardiogram. That's the big one. And to get a MUGA scan, because that'll show the most and it's more accurate, but it has radiation. So that scan you should really only do once in a blue moon, or if there's something that they notice is off on your echo. And the other test, the test for heart failure, is a blood test. I think it's a great test. It's what notified them that I was in pretty bad heart failure. I think my number was 1987 or something. And like I told you, your numbers are supposed to be in the hundreds. And I thought there was some sort of a typo because mine was in the thousands. I didn't have like your classic symptoms until right before my TAVR was done. But I also think that maybe if I got the BNP earlier, they would have flagged that I was in heart failure. And even though I wasn't having symptoms, I could have gotten the TAVR done earlier. I don't think it would have stopped me taking the Orlissa, which I do feel that formed that blood clot. I think it just would have taken longer. And maybe if I didn't have to take the Orlissa, I would have had this down the road, maybe 10 years from now. But you can't go backwards, right? So we can only go forwards. I just did that this morning. I was like writing out some keywords and I thought about the Orlissa and I thought, damn it, if I didn't take that medicine, like it's a non-factor. I was going to take it no matter what because I wanted the bleedings to stop for me. So I took it. However, I took it knowing that my chest had started to hurt and stuff, and I stopped it, but it was too late. Now I wouldn't have thought a blood clot formed, but now at this point, I can at least let the company know that it happened to me. So maybe in the future it can prevent it from happening to others. And maybe even people on this border suffering from fibroids, and that's offered to them. Know now that that's a drug that we shouldn't be taking. I think that everybody should, if they don't have a cardiologist, they should. If you're a survivor, you're definitely going to need one. If they tell you don't need any of those types of things like an echocardiogram done for proactivity, you definitely have to get a new cardiologist. Your long-term care provider, which I was lucky enough to have Dr. Effinger, made sure that I had all my specialists that I needed for someone who was a survivor of Hodgkin's disease, which include covering all the bases, your thyroid, your breasts, even the men, anybody who had severe mantle and abdominal radiation, especially women. And I don't want to cut out the men because they still can get leukemia, and you still have to watch your prostate if you're a male. For the women, if you had abdominal radiation, it usually cuts off at the beginning of the uterus. So there's a high chance for uterine cancer and endometrial cancer. It's higher than normal. So you definitely should get checked and have a good gynecologist. Who's a chronologist. You should have somebody who's a good PCP who knows about Hodgkin's disease and can stay in touch with your cardiologist, which should be on your team as well. That's unless you've gone through other cancers, then you should have a good oncologist that is part of as well. I know that everybody's scribbling because I know I would be. I do want to tell you that when I had breast cancer, it was early stage, but even though it was early stage, I had both of my breasts removed. Now, at the time, it was still early. They didn't do prophylactics readily. I wanted them to take my left breast, and they wouldn't. So I had to suffer through another cancer diagnosis in 2006 with my left breast, which was also stage 1. I can't get anything taken out of my right arm because I had 13 nodes taken out for the breast cancer. They were all negative, but now I get lymphedema. So the other thing that I would offer as advice going through the massive heart attack is if you can have something around your neck or around your wrist in case you're not able to talk and they bring you into the ER. They used my right arm, so I have to get a bracelet that says no right arm, because what happened was my whole right arm blew up because I was knocked out and they did a catheterization through it. Also, have your information readily available. I have it in my phone. So if you press the emergency button on my iPhone, it'll come up. And you should have your will in place, not to be morbid, to help people and tell them where it is, God damn it. Because I had told my son and he was really mad at me. And now I feel very fortunate because he knew where to go and what to tell others when they said, I'll step in and tell them what I want done with Jessica. And he said, it's already written in paper and she wants me to carry it out. So that's a must for everybody, for your family's sake and for yours. You should get that all in writing and have it done so no one has to suffer through trying to figure out what your needs are, what you want. So mine was down there and I'd get given my directives if I wasn't able to wake up, what I wanted done. And I definitely didn't want to be kept on life support. And I'm pretty sure a lot of you feel the same way, knowing what we all went through together. I always wanted quality over quantity. But I do want you to remember that with it, as with everything, getting a heart transplant is a big, big issue, as is the medication. The medication is the number one thing that you have to assimilate your life to after it's done. And as I told you, some of those medicines you will be on for the rest of your life and duration of that transplant and that organ. And that was hard for me and still is. And yes, I'm in a lot of therapy, but now I think about my son and how he said, I can lose you from my life in the moments where I feel like I don't know if I can do this, because I think we all go there to that place, and that's okay too. So being able to share that with somebody else is really helpful and a big thing. So have somebody or some buddies in your life. So I like the term somebodies because it has a double meaning to it, but you need them. So I am going to let Sophia open up the conversation if she's ready.
Okay, Jet. That was great. You know what I'm thinking? I think it might be a nice time for me to share my screen and you can walk people through your journey.
Sure.
Yes, Sophia, can I just say one thing
Yeah.
before you get started? So after this, when you can decide about the photo piece, but is everyone okay if we continue to record? And I want to ask this to the group because I have a feeling there's going to be some questions that Jess can answer that are going to be very helpful to someone else. And normally we don't do this, but if anyone has an objection to having their question read or sharing information yourself, can you please put it in the chat and then we'll stop recording. Otherwise, if it's okay with the group, we'll continue. Okay, sorry.
Oh, it's all good. Can everybody see that?
I think most of them are on mute. I think one person responded they could.
Can you guys see the share screen?
Can you just put in your chat, yes, if you can see
Yeah,
it?
yes, I can see it.
We can see it.
Okay, good. All right, Jet, you want to walk people through this?
Yeah, sure. So in the upper left corner, you can see Gail and Sophia and my Charlie Brown. This is actually in the beginning. I don't remember Gail's visit to show you, like, I think I remember a little bit. I remember Charlie Brown. So I was in and out. This is, I believe, before my transplant. I'm not too sure. I think it is.
Yeah, it was, Jet. It was
Um,
before your transplant.
okay, yeah, I have the tracheotomy there. Okay. This middle one, which is next to the chapel and kind of encroaching on the one in the upper left, is just me, and this is before as well. I see my mother has gotten to me with the rosary beads, which they had to take off of when they did the heart transplant, and you found beads all over the place. But I have the tracheotomy there, because I told you I needed it so to breathe. And I had the balloon in me still, which was helping my heart to pump. So I had to get another balloon in me. I had mentioned to you that one of the balloons failed. So they brought me back into the OR to replace it and put in one. And they ended up putting it in my shoulder area so that I could move my leg, because it was in my leg. And when you have it, you're not supposed to bend that area because it will bend the tubing and then you can't get the blood flowing. So when I had the tracheotomy put in, I'm sort of kind of flowing into the middle where I've written, I appreciate all the prayers. Hopefully I'll get put on the list for the heart soon. So I couldn't speak when I had the trach. So they gave me a pen, a Sharpie, and I was writing everything down. And at first I couldn't write. I had lost my cognitive skills, but right there I'm pretty steady. So at that point I was on PRN and I wasn't allowed to get food or drink. And I was starting to lose my mind. And I was in the hospital a lot, alone, even though my parents and everybody, I probably wasn't, but I was so out of it a lot of times that I felt like nobody was there, and, texting them that I got kidnapped. I was crazed. So there was a lot of pain medicine. So I'm just going to flow over to the right and then I'll go to the next row. So that's my boyfriend over there. And he was in every day. I think that's the most emotional I've ever seen him. And I still didn't have, I don't believe I had the heart transplant yet. Okay, this one is me writing again about, I feel like my heart is my best friend. Okay, I've had the heart transplant at this point. And I sort of could feel her. So we were not supposed to know who our transplant is, but they were a cool bunch of people in the unit. They still wouldn't tell me a name, which I was fine with, but they did tell me it was an 18-year-old. And I didn't know how to feel about that, because although felt blessed, I felt like, my God, what a sacrifice, because I was 11 when I had Hodgkin's. And at that time, they didn't know if they could save me. And then I was saved. And I went on and I got my first breast cancer when I was 25. And yet I was still older than her at that time. So I thank her, and there's a part of me that feels very sad. But then the part of me that feels like, what a sacrifice. So it's my job to bring her with me now, which I will for the rest of my life. And I'll let her live through me. So there are sometimes that I'll do something that I would never normally do. And I thank her for that, because she's definitely feisty and she's definitely very opinionated, like me. So my boyfriend has been like, you're just totally different now. And I don't know if I like it, because I told him off plenty of times since. Okay, down here is the Duke Chapel, where a lot of my family and Sophia went while I was in the hospital. Like I said, it was 8 weeks. Now, if you have a planned transplant, it will not be 8 weeks, but I had a massive heart attack followed by a lot of different surgeries to help keep me alive. Plus, I had pneumonia. So that was a big difference. Hopefully, there are 2 other women that are possibly going into transplant. They would not have this experience because they are not going in on a massive heart attack. They're going in with the idea of prepping for the surgery and then getting it. So I'm going to venture down to the middle. I feel like I'm on Jeopardy. Okay. Yes. Here I am listening to my new heart, which I've named Rockette, because at first I called the heart Rocky, but then I found out that it was a female and I called her Rockyette. And then I forget if it was Sophia or somebody else that said, why don't you just call him Rockette? And I said, okay, that sounds good. So she's now Rockette. And this is me listening to Rockette for the first time. And I was just speechless. It was just hard for me, but I had a trach in, so I was speechless anyway. But it's amazing to hear a different heart in your chest. There are no words. So again, I'm grateful. I have an ejection fraction of over 55 now, and no worries about stenosis, or mitral valve regurg because I have the valves too. So that was a question that Sophia had asked me the other day. Okay, if you go to the right of that picture, you're going to see me walking without my cane or rollator for one of the first times. So although I was unsteady, I was very happy. And also, this must be one of the first weeks into the prednisone because I don't have the moon face yet. So you can see as time goes on, not in this collage, but as time goes on, like down here in the lower right with Sophia, you can see that I've gotten the lower part of that swelling, which is just fat redistribution. Couldn't get that word out. And right above Sophia and me, you'll see me with a rollator or a walker. It's a walker. Okay, this is after I got the heart and I was in the step down unit and they wanted me up and walking. So I got up and walked for one of the first times around the area. So we did a lap and then we did a couple of laps and then they were like, you're ready to go home. So I went home on December 21st. I got the heart on December 9th. So it's pretty quick that I went home. The lower left-hand corner, we should have hid and buried, Sophia. So this is me eating an ice. This was a no-no. I was so parched that I was like, please let me finish it. And they didn't, but I did. They left the room and oh my God, I did drink some of it. So that was horrible. So everybody blocked that one out. Next to that is Dr. Effinger, the famous legend. He came in to see me. I'm not sure what stage this was because remember, I was in an induced coma at the beginning. What I didn't tell you was I was so disoriented. I was trying to pull out all my stuff, including my feeding tube and my breathing tube. So they had to tie me down to the bed. And this was not at that point, or I was beyond that point because there's the feeding tube. So I guess that was beyond that point and I was better. So Dr. Effinger came in. He's now retired. So that was one of his last visits. So I'm glad I got to see him. And that's one of the only times he didn't wear his mask. So I feel like that's amazing too. So that is a travel around the collage. There were other pictures. I'm sparing you from them because they came at the beginning when I had flatlined. So I felt like you can ask me about it, but you don't need to see that because some of them are a little frightening. Okay.
There's a couple questions here. There's a thank you from David Cunningham for sharing your story. And he is asking, have your lungs been affected by fibrosis? That's one of the issues he's facing with now as he seeks a heart transplant. So question about your lung function.
Yes. Thanks, David, and thank you. It's my pleasure to share the story. My lungs do have fibrosis in them. It's not to the point that it's anything that my doctor is concerned about, but I have the usual suspects for anybody who's had radiation. I have nodules and I have scarring in my lungs. I also have what mimics asthma, but it's not asthma. So getting an inhaler from multiple doctors does nothing. So Dr. Effinger told me to throw out the inhalers, drink some warm water, hot water, and that's about it. But no, it wasn't a factor in getting the heart transplant.
Thank you. So Faith has a question, and this could be very emotional and maybe a little too personal, but I think it's something that everyone is curious about. And what she's asking is what you saw when you first flatlined, and you referenced this, but if you could speak a little bit more about what you can remember, if anything.
Okay. And who is this that asked the question?
This is from Faith Dieter.
Okay, I see her. She's on the bottom of the screen. Okay. Yes, Faith, I actually crossed. And for those of you who don't believe in that's okay. This did not happen when I first flatlined, although I thought it did. It happened during the time that all my organs were shutting down. And I went somewhere which I can only relate to as purgatory. And it was very frightening at first because what I saw there was all my biggest fears in a culmination of one place. And I was alone, which is my biggest fear, abandonment. And although I looked for help, it was nowhere to be found. And I was in a field. And I won't tell you the whole thing because it'll take forever. But I was aware that if I wanted to come back, I was going to have to fight for it. And there were going to be some tests. I knew that I didn't want to stay in the field. It was freezing, which is another thing I fear. And as far as there was no help and it was cold and I didn't know which way was out. So I just continued to move. And then I ended up on an airplane. And the airplane was just idling, and I was in the aisle seat, and a woman approached me, and she had me in a book, and in the book was the entire plane, and she said, "Let's go through your life." And she started to turn the pages, and on the pages were beautiful points of my life. And she said, "But you didn't care." She started ripping out the pages. No, she did. My memory of that time failed. And I started to forget like my kids and my parents. So anyway, I just want to say I ended up back in the field. And I've jumped over some things. This would take forever. And there was a bunch of bodies and I was in the middle of them. And I said, I know I'm not on Earth and I'm probably dead. And it's been a while. So if I want to get back, I'm going to have to get out of here. And I couldn't push through the bodies. I was stuck. And then I heard my sister. And she was screaming for me. So I started to push as hard as I could. And I broke through and I was on the other side. And so that's what I'm going to share with you right now. And if you want to know more, you can message me in private. But that's what I saw.
Thank you. Thank you for saying that. That's a lot. And I know others will really appreciate it. It's a human thing to be wondering what happens. And it was lovely of you to share it. Thank you.
You're welcome.
And Faith also wants to know, with the new heart, does that mean you have a normal lifespan now?
What's normal, right? I mean, anybody it's not normal for, but in this day and age, what the hell is normal? Yes, you can have a normal, I guess you mean like, could you have 20 more years? Well, we wondered that about Hodgkin's, and at the time we did what we could to save ourselves. And now look at the repercussions. But I think that, yes, you can live a much longer life. One of the people that I spoke to that had a transplant He was male. He is male. He just got his transplant too. And he said he thought he heard that you can only live for 6 months. I'm like, I think you better do some more research since you got one. You can live a normal lifespan with a new heart, yes, which is very encouraging. So I can live much longer with this heart than I would have with my other heart. So with all of the problems, this heart is in great shape. She took very good care of it. So.
You know,
Awesome,
Jeff,
thank you.
I would also add in cardiology, they've made so many advances, much more than in cancer. So, you know, if and when you would ever need a new heart, chances are it's going to look a lot different in the future than it does now.
And even the medications will look different, which
Yeah.
I'm excited for. So it's ever changing, like year to year with the heart, and hopefully that'll like be with cancers too. But it's not just yet. They're moving faster as far as cardiac stuff.
Okay, Anastasia has a question, and I'm going to let her ask.
Hi.
Okay, hey,
Hi.
Jessica, thank you. Oh my goodness, thank you so much for being so kind and courageous to share your story.
My pleasure.
It was incredibly, well, moving and also encouraging because you're such a bright light and you're such a strong spirit. So it's really, really neat that you're speaking today and speaking in general. Um, so yeah, I actually had to leave the room because my question had to do, I was actually sitting across from my 11-year-old, and you have kids. I know
Yeah.
you mentioned them several times, and I have 11-year-old and a 7-year-old, yeah. And like I'm 15 years out, but like you, I had 36 gray to my chest. And so I am just wondering when and how did you, I mean, it might have happened differently with you because you had the breast cancers, but how did you start talking to your children about it? Like, did you try to hide it from them at all, or were you really
Um,
open about
I
it? What did you do?
That's a good question. Well, they're all good questions. I couldn't hide it from them because when I got my second breast cancer, they were in the house and they were going to see me without my hair, and I didn't want to wear my wig. And so I always felt that it was important to be honest with my children, who are now 21 and 20. And so I let them know right away because I knew it was better to get over get over it than through it. And I didn't want to lie to them. So children are really smart and resilient, and it would have been worse if I didn't share it with them. I'm on a huge call, Dad, just so you know.
Oh,
So
with the
he's
what huge
going
what?
around.
Oh, okay. Well, thank you for, sharing how you did that, and also thanks for all the info, including thinking about, will and advance directive. I honestly haven't even, I mean, I have nothing in place for any of
Yeah,
that.
I
So
think that's
it's big
really.
stuff to start thinking about, but you're right. It helps other people if it's
Yeah,
needed.
and I think too that if you wanted to introduce something to your children just to make them understand like the what ifs, like that's good too, because there are some books out there that speak to children about what happens when mommy or daddy is going through cancer treatment. And I think that those things are really important. I know that both of my children I had in therapy, and they were able to talk, which they felt privately, and share their concerns. And so I encourage you to do that now and not wait till later. So if something should happen, which I hope it doesn't, but we know that the possibilities are there, right? So it's better to share stuff with them in a place where they're not terrified and in a place where there's calm than it is when there's chaos happening. So talk to them. Just talk to them regularly, like smart little people, because they are smart little people. So
Right.
that's
Oh, thank you. Thank you, Jessica.
welcome.
Okay, other questions? I'm not seeing any other than I just had a question about the drug that you were taking and whether or not there's an equivalent to that, but now I don't remember which drug. Tess, can you either write or unmute so and ask that one?
It was actually Louise who was asking me
Oh,
about
okay. Okay.
what the
Go
name
ahead.
of the drug was in the UK, and we weren't sure what the name was. And then I went looking on the internet and found what I thought might have been it.
Was this a heart drug or another
Oh,
drug?
it was the bleeding, the clot
Oh,
bleeding drug. Was it Lystida?
No, well, Lysida, yes, it's a version of that. It's called Orlissa.
Okay, because that's a trade name, and we were just wondering what it actually is. How do you spell that? O-R-D?
ORL
O-R-L.
ISSA.
Thank you. Let me have a little look and see what that is. Yeah, I was just looking up what it actually is. In terms,
what it does is it works for endometriosis, but what it does for people that have fibroids is a lot of times it helps to stop the bleeding,
okay.
and just
It looks
kind of
like it's
coagulate the blood.
it looks like it's a prescription medicine for pain.
Yeah, it was not prescribed for what it usually does for me. It was for bleeding because I was bleeding so much from the fibroid.
Okay.
So I
Okay.
was taking it as a coagulant.
Yeah, it looks like it lowers your estrogen levels as well. So it was fiddling with your hormones. So I guess that's how it has the effect on the bleeding. So
Yeah.
it's not, I was wondering if it was one of the more traditional drugs that we use when people are bleeding heavily, which are known to cause a side effect, increased risk of causing a clot where you don't want it. But it sounds like it's probably doing it through its hormonal effect and increasing your risk, I guess, by doing that.
Might have. See, a lot of people don't know. So I would either way, I'm going to let the company know what happened. So
I definitely think you should, because they need that sort of after sales feedback, don't they, to just pay into things and know about it. And
be warned.
yeah, and also when you're on so many medications as well as this other stuff you will have been on already at that point, I guess, for heart problems and so on, it gets complicated as things interact as well. But it's
I
definitely
wasn't really on anything for my heart.
you're not at that point. No. Okay.
No,
Fair enough. Thank you for telling us what it was.
absolutely.
Thanks, Tess. I'm going to go to, I'm not sure if it's Dinah or Dina. So why don't you go ahead and jump in? I know you have a question.
It's Dina. Thank
Okay,
you.
Dina.
Hi, Jessica. Thank you so much for sharing your story. That's pretty amazing. I'm a 22-year survivor, and 18 months ago, I had open heart surgery for my late effects. So I have been there a little bit. But I had a question. When you first started speaking, you said that when you were first diagnosed, you only had radiation, and then when you relapsed, you had ABVD.
Correct.
Was there a reason why they didn't want to do ABVD when you were first diagnosed?
Because at the time, the doctors had thought, and I don't think that might have been the greatest hospital, although it was at the time in New York. They felt like it was stage 2A, and they felt that it was early stage enough where they didn't want me to have to get chemo. So in retrospect, I wish they had just given me the chemo and been done with it. But at the time, they were like, she doesn't have to do much. She just needs the radiation. And so they were doing it. They thought they were going to do a minimal amount of damage, but it ended up being not worth anything because the tumor grew back and I had to get the chemo anyway. So
Right. I was also stage 2A, and I wasn't really given a choice. I mean, of course, I know it's always a choice technically, but they said, chemo and radiation. But so I thought that was very interesting that you didn't have that first time around. So
no. And
okay.
Did you relapse at all, or you just had the chemo radiation?
Chemo and radiation and then remission.
Okay.
Yeah. And 20 years later, I had, aortic valve replacement, double bypass, and aneurysm repair.
Oh, wow.
It was huge. So
how are you feeling now?
It's a new normal. I'm not perfect. I still have some lung stuff going on, so I'm a little bit short of breath from my lung situation, not the heart. But I mean, it's been a long journey the past 18 months.
Yeah, I get it.
It was more than it, and emotionally, it really affected me more than I knew that it would.
Me too.
So, yeah.
Yeah,
Well,
that's-
congratulations. You're an amazing survivor.
yeah.
Thanks, Dina. Thanks for popping on.
Thank
Faith,
you.
are you still there? Do you want to unmute and ask your questions since we didn't get to do that before? If not, we can
Sure,
read it for you.
sure. It's a quick one, and sorry my camera is not working on this, but Jessica, thank you again so much for sharing, for just being a role model for the rest of us, and just the information you're sharing is so helpful. Would you mind saying again the name of the scan that you mentioned that does have radiation but
Sure.
is a really good scan if you need a problem? And could you spell it? Because I
Yeah,
want to
I
write
will
it
do my
down.
best. It's a MUGA scan that has the radiation, but it's a more precise scan. And I think maybe Paul can help me. I think it's spelled MUGA.
It is.
It is.
Okay.
It is.
Awesome.
And it may not be there are lots of other scans too. Sorry, I'm butting in because I'm medically trained. And also
I
having a
figured
few.
you were. I figured after the last question. I'm like,
Yeah, I know. I can't help myself. But also, actually, sometimes an MRI scan can be helpful for some heart conditions, or a CT. So I think it depends exactly what the issues going on are, which is why you need a cardiologist if you've got anything going on. I totally agree that echocardiograms are really valuable screening tools and very safe because it's ultrasound. And they give pretty good pictures with a modern echo. And then if stuff's showing up, yeah, you need a cardiologist, and you need them to tell you what further investigations are going to be useful to understand what's happening with your heart. It might be a MUGA scan, or it might be an MRI, or it might be that you need catheterization or something. So just to kind of open it up a bit, but I completely underline the get your heart followed up. Totally.
See that. But if I could add on to that concern with the MUGA scan, Dr. Effinger is always reluctant to want to expose any of us to more radiation. But he also recognizes the value if it comes down to being the tool that has to pick something up. So I believe Jessica also has lung nodules, if I remember correctly. So do I. But Dr. Effinger, every year that I saw him, ordered another CAT scan for me to follow up on those nodules. They're still not identified, but they're watched to see how fast and if they grow. And if that catches lung cancer before it gets too great, then that risk to that more radiation has been worth it. So that's just my 2 cents on that. Nice job, Jess, by the way.
Thank you, Paul. I think that it's important to note, I'm sorry, what Kat said. I got the MUGA scan done after I had the TAVR so that they could really see my ejection fraction, because you can see it on the echo, but he wanted a very precise read. I wasn't getting MUGA scans before that. The only other time I had a MUGA scan was when I was on Herceptin. So there's always been a real reason why I've gotten one. The MUGA scan was done because my ejection fraction could be really, really halted or slowed down because of the Herceptin. And my left ventricle was very damaged by the Herceptin. So I was glad that they did that type of a scan for that issue, but it was for a very specific issue.
Does anyone else want to jump in there? We have a few minutes.
I just had
David?
one quick follow-up, kind of my typical go-to, but I think it's important for us, and I'm sure all of the folks that are on this call probably know this, but I've found that just any old cardiologist is not necessarily going to work. I'm now using not only my cardio oncologist, who I believe is the second coming, and has been, my godsend, when we've had her on this call, but having her back up my traditional cardiologist, who I've now fired, and go to a heart failure clinic, which now things seem to be working. feeling as good as I felt in over a year. But it's important, as Jeff kind of mentions, you got to take your own reins and sort of steer your own ship and make sure these folks are doing what we want them to do, because they're going to do what traditional cardiologist is going to treat you like a traditional cardiology patient. We are not that. That's one thing I've learned over these past few years, is we are something so different. And I don't think anybody really knows, but the people like Dr. Tochi and these cardio-oncologists are really helping to figure out. And so anyway, that's my 2 cents. I'll stop there.
So I'm gonna give a backwards introduction. This is David Cunningham, who we've known for quite a while now, and David introduced us to Dr. Tochi Okwesa, who appeared in a Zoom meeting. So last year, David, or the year before?
Yeah, I think it was
last year. She was fantastic. Yeah, and she really was the first time we heard from a cardio-oncologist, and that is also on our YouTube channel. So if you missed it and you want to see it again and hear David and Dr. Tochi, as we finally call her, you can tune into that. So, wow, I feel like I need a vacation after this. This is a lot. And Jess, you were amazing. I mean, it's an amazing story. I'm really pleased that you had the chance to tell it. I'm really pleased that you had the chance to tell it to us this way, because it feels very intimate, which I kind of like. And there's a lot there that is very personal. So I hope that was okay with you, and I applaud you for being willing to share all that. That's a lot. But we're very, very inspired by your story. It's really wonderful. It gives us all hope. So thank you. Thank you so much. And you can all, well, we wish you all the best, Justin. We hope you keep us posted on how you're doing. It means a lot to us to.
Yeah, you'll see me at the conference too.
We'll see you at the conference. Yeah, that'll.
Take care, everybody. Feel well.
Thanks so much.